about risk behaviors of oncological patients in follow-up. There aren't conflicts of interest. The research was done during a nursing residency program in Brazil at a pediatric oncology hospital whose focus was to study survivors of the childhood cancer. Childhood cancer is considered rare when compared to the tumors that develop in adults, representing 1 to 4% of the malignant neoplasm. In Brazil, for the year 2019, 12,500 new cases were estimated. It is the disease with the high degree of lethality and the second cause of death in almost all regions of the country. Actually, there is not scientific evidence that childhood cancer is preventable, so prevention is a challenge for the future. The current emphasis is on early detection and referral to specialist centers. This allows for better chances of cure. The survival rate increased in recent years, mainly due to new therapy modalities such as immunotherapy and others. The Pan American Health Organization aims to achieve a survival rate of at least 60% for this population by 2030. Actually, in developed countries, the survival rate is 8%. In Brazil, 64%, and in Barretos from 2000 to 2070, it was 55%. Follow-up is considered the survival period for patients. However, today there isn't consensus as to when follow-up begins. After treatment, after the 5-year stage of cancer diagnosis, or time of separation from end of life care. Malignant neoplasm predisposes young survivors to several late effects with morbidity and mortality rates. These can be potentiated by the involvement of young people in risk behaviors typical of their age, such as tobacco, alcohol, and illicit drug use. This population creates a number of challenges for healthcare professionals, so it is important to understand the long-term impact of the therapies used and the risk behaviors of this population to improve care. The study aims to understand specifically how patients in follow-up after the end of oncology treatment find themselves regarding risk behaviors and to have a better understanding of the peculiarities and the demands of these survivors. Methodology. Transversal, descriptive, and prospective studies with quantitative approach done at the outpatient of the Barretos Children's Cancer Hospital The sample consisted of patients who attended the follow-up appointments. The inclusion criteria were completion of the treatment 5 years or more ago, age 16 years or older, understanding the Portuguese language and being able to communicate with the researcher. The data were collected between 2008 and 2019 through a structured questionnaire, and the 30 variables were social demographics, dates and behaviors, and clinical data. The ethical aspects followed the Brazilian law about research with human beings. 71 patients were included, and of these 52% were women, aged 16 to 39, 73% were single, 68% reported being white. 80% were from the southeast region, 45% were Catholics, 35% incomplete university education. Regarding diagnosis, 27% of survivors had osteosarcoma, followed by Hodgkin's lymphoma and non-Hodgkin's lymphoma. 73% had no metastasis at diagnosis, chemotherapy and surgery was the therapy used in 45% of the sample. Treatment duration greater than 12 months was 41% of the sample. Average time of therapy was approximately 11 years. Surviving for 5 years has been only the beginning and not the end point of treatment. Later effects impact the survivor's daily life. The complexion of the cancer treatment often makes patients feel more vulnerable. With regard to the initiation of sexual activities, 87% had already started. 45% were not using contraceptive methods, and the average age of initiation of sexual activities was 17 years. Sexual activities and fertility can be affected by therapeutic modalities. It is estimated that every year 4 million young Brazilians become sexually active, and the current trend is for earlier sexual initiation. Sexual relations in Brazil are occurring in adolescents 13 years of age or younger. Regarding nutritional state, 37% of patients aged 16 to 19 were diagnosed as overweight, and 13% of patients aged over 19 were diagnosed as obesity. Obesity can be due to treatment-related factors such as corticosteroids, as well as concomitant or non-concomitant use of cranial radiotherapy. These can cause hormonal problems. The studies point out that unhealthy choice and the reduction of physical activity are factors that obey for weight gain. With regard to tobacco use, 38% had tried it at last once and 80% currently use it. The average age of first use was 16 years old. With respect to alcohol use, 84% had tried at least once and 65% currently use. The average age of the first time use was 16 years. With regard to illicit drug use, 20% had tried at last once and 7% currently use. The average age of first time use was 17. The use of illicit and illicit drugs are risk behaviors that usually begin at an early age and last throughout life. Habitual use of the substance causes lifelong implications. Adolescence is the most vulnerable age group to drugs, and this is a predictor of the substance abuse health problems. It's called failure and increased use of health services. Many may be related to this stage of life, such as taking new experiences. Evident risk behaviors are observed in the population of childhood cancer survivors and in the general population. This data can help the team plan care to restore the lives of these individuals. Further studies in the multidisciplinary field can be conducted with this population. This research was done due to a personal concern about the survivors of childhood cancer. Many studies show the later effects and feel the risk behaviors. Are we properly for these patients? Do we have enough data to plan individualized care? I'm very grateful to the institution where the research was done for the support and especially to my advisor, Deborah. That's my contact. Thank you.
Thank you, Natália. Thank you for sharing your research work with us. Any questions for Dr. Natália?